Hello everyone. Today we are going to talk about generalized anxiety disorder. And if you still have not watched the introductory video on anxiety, it will be better if you go through it before watching this video. And we have put the link below. As for a quick recap, anxiety is a feeling of fear about what is to happen, and this is quite normal if we are in a fearful or stressful situation. And, most of the time, it is the body's natural response when we are in stressful situations. On the other hand, it becomes a disorder when we feel fear and anxiety in perfectly normal situations. So, by definition, anxiety disorders are a cluster of mental illnesses which cause significant and uncontrollable feelings of anxiety and fear that can lead to significant damage to the social, occupational and personal activity of an individual. Anxiety disorders are mainly categorized into three types. They are generalized anxiety disorder, phobic anxiety disorder or simply phobias, and panic disorder. So today we are going to talk about generalized anxiety disorder. So, in generalized anxiety disorder, there is persistent and excessive worrying throughout day-to-day life. A person with this disorder will be in anxiety almost all the time. And several studies have been found out that 2% of the adult population in any year presents with generalized anxiety disorder. It is commonly seen in females compared to males. And it is often associated with depression. The clinical features of a generalized anxiety disorder include constant worry and apprehension that is more prolonged in healthy people. The worries are widespread and not focused on a specific issue. Muscle tension may be experienced as restlessness, trembling, inability to relax, headaches, or aching of shoulders or back. Autonomic overactivity is most commonly present as sweating, palpitations, dry mouth, or abdominal discomfort. Psychological arousal may be manifests as irritability, poor concentration, sensitivity to the noise. Some patients may complain of poor memory as a result of poor concentration. Sleep disturbances may be seen as difficulty in falling asleep and persistent worrying thoughts. Sleep is often intermittent, unrefreshing, and may be accompanied by unpleasant dreams. Causes of generalized anxiety disorder could be due to following stressful events, genetic factors, and may be due to early experiences in life, certain personality traits, and may be due to neurobiological mechanisms. Clinical observations show that generalized anxiety disorder often begins with a stressful event. And some even become chronic generalized anxiety when these stressful events persist. Several sociological studies show that early adverse experiences are a significant cause of generalized anxiety. The neurobiological mechanisms involved in generalized anxiety disorder are those that mediate normal anxiety. These mechanisms are complex, and these involve several brain systems and several neurotransmitters. Several studies show that in generalized anxiety disorder, activation of areas in the brain such as the amygdala, somatosensory cortex, cingulate cortex, and hippocampus are observed. Now, let's talk about the treatment of generalized anxiety disorder. These include self-help and psychoeducation, relaxation training exercises, cognitive behavioral therapy, and medication. Patients should be well educated about their condition and practical exercises should be taught in order to get maximum benefits. Patients should be taught how to continue relaxation exercises. Cognitive behavior therapy is more focused on helping the patients to control worrying thoughts. Medication for generalized anxiety disorder can be divided into long-term and short-term medication. Short-term medication are benzodiazepines, such as diazepam and lorazepam, azapirones like buspirone, and beta-adrenergic antagonists like propranolol and atenolol. These short-term medications cannot be given for the long term because they can cause more side effects with long-term use. Long-term medication for generalized anxiety disorders are selective serotonin reuptake inhibitors like sertraline, citalopram, paroxetine. and serotonin and noradrenaline reuptake inhibitors like venlafaxine and duloxetine.
Hope you enjoyed the video and don't forget to like, comment and subscribe.